The SAFE programme aims to improve outcomes for children and young people by increasing situation awareness in paediatric ward settings. And the way that we have implemented this through our safety huddles as a tool for improving situation awareness is by being able to proactively predict children at risk of deterioration. So we've incorporated our paediatric early warning score charts, but we've also asked other questions of children whereby we may be able to identify concerns and predict who might be at risk of deterioration. And apart from the safety huddle, we've also incorporated other improvement work such as daily plan whiteboards and engaging parents in the ward safety culture, so that actually we can think about the wider improvement works we can do involving the whole team to improve outcomes for children.
So as part of the SAFE programme, we've looked at communication with young people, and one of the ways that we're all working from the same hymn sheet, so to speak, is using a whiteboard. The idea behind them is that young people can also contribute and write what they are doing that day and what they're looking forward to, as well as we ask them what they'd like to remember medically so that they have a reference to go back to. So they both feed into the huddle, and we also have a prompt in the huddle to use whiteboards.
What Safety Huddle has done for us as a multidisciplinary team is give everybody a voice. It's helped us to have collaboration, so it is really helpful to have that. So everybody can, come and highlight any concern, and that anybody has a huge contribution to bring to Huddle.
It's made my job really more interesting. I've really got to know the staff really well, the clinical staff really well, and the clinical staff have got to know us really well. And we now know everybody's names, we now know everybody's roles, and it's just good to have additional watchers, additional people feeding back into the safety of the patients that are on the ward. And that changes every day.
SAFE for me has helped an environment and encouraged an environment where we're all aiming for better communication with families and young people. It really lifts the morale of the ward, and there's quite an excited feeling when you go to Huddle in the morning. Everybody's pleased to be there.
So when I come to Huddle in the morning, we go through all the safety factor on the ward, patient list, and any concerns from patients, from the nurses and doctors and all the MDT, the school teachers. And that kind of sets me on how to plan my day. So which parent do I need to speak to? What is a staffing issue? What do I need to do?
Some of our staff, they spend sometimes over 2 hours with individual patients. So we can really establish really good relationships over long periods of time with patients and their families. And we feed that back to the clinical staff, and that all contributes to the well-being, the improved well-being of our patients. It's fantastic.
On the RCPCH website, there are 4 free video tutorials of Dr. Peter Lackman delivering the complete SAFE training, which you can watch on your own or with your team. You can also download free practical tools and materials which will help you to design your own projects, huddle scripts and collect project measures. Once you've done your SAFE project, you can share with others on the RCPCH Sharing QI platform, www.qicentral.org.uk.